Which one of these people has kidney disease? Are you at risk? Do you already have it? Watch this video presentation and learn the ABCs of kidney disease from noted nephrologist Dr. Paul Crawford. Why are kidneys so important?
The kidneys are important because they wash the blood, and the blood from the heart is pumped into the kidneys, and the kidneys then filter that blood and get rid of certain poisons and toxins that are in the bloodstream that result from just normal body metabolism. Those poisons then go into the urine, down to the bladder, and then out. So the kidneys are the filtering station for the entire body. The kidneys are located in the back, just underneath the bottom rib on the right and left side. They're about the size of your fist, and they contain about 1 million small microfilters called nephrons. The nephrons filter the blood and keep the chemistry of the body in balance in terms of sodium and potassium and calcium and phosphorus and magnesium, all of the various salts that are in the blood.
What exactly is kidney disease?
Kidney disease is any abnormality in the kidney. It could be the filters of the kidneys that are not functioning properly. There could be cyst in the kidneys. There could be a blockage in the kidneys, or any abnormality in the kidney is considered kidney disease.
What is chronic kidney disease?
Chronic kidney disease is a problem with the kidneys that's occurred over a period of time and is not reversible, and generally results from long-term effects of chronic illnesses such as high blood pressure and diabetes.
What is kidney failure?
Kidney failure is often when people are below 15% kidney function, and therefore those patients need dialysis or a kidney transplant.
What is acute kidney failure?
Acute kidney failure is when your kidneys are normal prior to some event that happens, an automobile accident, a gunshot wound, certain medicines that are toxic to the kidney, or an infection that makes the kidneys, which were previously normal, shut down suddenly, and you may recover often from acute kidney failure.
What causes kidney disease?
The most common cause of kidney disease is diabetes mellitus, or some people call it sugar or sugar diabetes. Number 2 cause is high blood pressure or hypertension. Hypertension is an elevated blood pressure, greater than 120/70. The combination of diabetes and hypertension is very high on the list. Other causes, some people have inherited disease that's picked up from your parents or grandparents.
How is kidney disease detected?
Kidney disease is detected by a blood test and a urine test done at the doctor's office or at a health fair, and we measure what's called a serum creatinine, which is a blood test, and from that we calculate what we call the GFR, the percentage of kidney function that someone has. And the urine test can pick up even very early kidney disease by looking for very tiny amounts of protein in the urine, or if there's red blood cells or blood in the urine.
Who should be tested?
Everyone should be tested, even if you're healthy, at your usual visits to your primary care doctor. If you're at risk, in other words, you have a family history of high blood pressure, a family history of diabetes, or you have diabetes or high blood pressure yourself, then it should be done on a regular basis. If your kidneys are normal, I would say annually. If there's an abnormality in the kidney, then that needs to be followed up much more frequently.
At what age should you be tested?
The age at which you should be tested for kidney disease is when you go to see your doctor. And that is, if you're 18 years and over, you should be tested at a normal physical exam. In children, they're tested in terms of having any risk factors or any abnormality in any of the regular tests that would indicate the need for that.
How is kidney disease treated?
Kidney disease is treated with controlling the blood pressure, with controlling diabetes, controlling the cholesterol, and making sure that there are certain medications being given to decrease protein in the urine. Those are methods whereby, if you have early kidney disease, we know that we can slow down the progression and in some cases even see improvement in kidney function.
What if the kidneys completely fail?
If the kidneys completely fail, then a kidney transplant is always the best treatment. peritoneal dialysis, which can be done at home, or hemodialysis, which can also be done at home or in centers.
How can kidney disease be prevented?
We can prevent kidney disease by first increasing our awareness of the existence of it, especially in high-risk populations. Being aware of what your blood pressure is, actual blood pressure reading, an actual blood test, an actual urine test, then will help us determine whether or not we have any problem with our kidneys.
How about diet and exercise?
The diet and exercise helps to lower the blood pressure, it helps to lower the blood sugars, it helps to lower the cholesterol, and if we can control those three factors, then we've made a major improvement in our kidney function as well as a risk for progression of kidney disease. One way to be tested for kidney disease is to attend a free screening, which is held the Saturday before Father's Day at Malcolm X College. By coming down, you can have urine tests, blood tests, look for kidney disease, heart disease, high blood pressure, and diabetes for free.
Join us at the DePello Institute next Health and Fitness Fair the Saturday before Father's Day at Malcolm X College to get tested for kidney disease and much more. Call us at 312-808-1909 or log on to our website at www.thepello.org. This video presentation was partially funded by the Illinois Department of Public Health.